Hello and welcome to FYI, or For Your Information. I'm Sarah Jacob. After black fungus cases in a new worry, today a COVID survivor in Madhya Pradesh has been infected with the green fungus, possibly the first such reported case in India. The 34-year-old patient, who battled COVID for 2 months before experiencing severe nosebleeds and fever, was suspected to have contracted the deadly black fungus or mucormycosis. However, after tests, it was found that he has contracted green fungus, an infection that had earlier been seen only as a junior partner in other cases. Today, my colleague NDTV's Akshay Dongre asked the health ministry officials about this emergence of this new green fungus in India. Listen in.
इससे पहले डॉक्टर रणदीप गुलेरिया साहब ने बड़े डिटेल में एक्सप्लेन किया था कि हम फंगस को कलर के बेसिस पर, विच इज लाइक कॉमन पार्लेंस में हम डिस्कस करते हैं, बट वी प्राइमरली डिस्कस इन द फॉर्म ऑफ इन्फेक्शन, फंगल इन्फेक्शन. तो इस तरह से हम डिफरेंट टाइप के फंगस करके वो जो एक डिस्कशन करते हैं, आई थिंक दैट मे नॉट बी नीडेड. बट व्हाट इज इंपॉर्टेंट टू अंडरस्टैंड इज कि अगर हम फंगल इन्फेक्शन है तो उसका इफेक्टिव ट्रीटमेंट जो उसके प्रोटोकॉल के हिसाब से उसको किया जाए.
So what is important to understand about the green fungus? What is the green fungus? Well, here's what we know. It's this newest disease. It is an Aspergillosis infection, and Aspergillosis is a relatively uncommon infection. It affects the gulls, the lungs, not the gills, I beg your pardon. And now on FYI tonight, a green fungus case reported in India. What is it? Who is at risk? What do you need to know about this new post-COVID infection to keep yourself and your loved ones safe? Well, we put together an expert panel for you. We have Dr. Ravi Doshi. He is the HOD of chest diseases at the Sri Aurobindo Institute of Medical Sciences, or SIMS. He's also the doctor who treated the first green fungus case in India. This is, of course, in Indore. We have Dr. K.K. Handa, Chairman of the Department of ENT at Medanta Medicity, Gurugram. We have Dr. Mahesh Lakhe, Consultant of Internal Medicine and Infectious Diseases at the Columbia Asia Hospital in Pune. And we have Dr. Colonel Rajwala Bhadoria, Consultant of ENT at the Bansal Hospital in Bhopal. Dr. Ravi Doshi, to you first. You treated this first green fungus case in India. First of all, tell us, how is your patient? What happened? How did you arrive at the conclusion that he has this green fungus?
Very good evening. Basically, this patient had presented to us around 2 months ago when he had contracted severe COVID-19. So he was admitted to the ICU. He underwent a lot of higher treatment, a lot of intensive treatment was on artificial respiratory support, and received a lot of higher medication. When he came out of COVID-19, he was sent home with oxygen. But around 10-12 days of going home, he started developing high-grade fever, nasal bleeds. He was bleeding from the motion area, and he was not at all well. So we re-evaluated him, and on re-evaluating him, it threw up this sinusitis, a lot of lung involvement apart from the COVID involvement. A lot of fever was there, so there was a lot of infection in his blood. So we readmitted. When he worked him up, did a biopsy, so it gave us Aspergillosis species as the reason of his sinusitis. The same we could isolate from the lungs and from his blood also.
All right. So, you know, India has been plagued by this slew of these fungal infections among recovered COVID-19 patients. Their immune systems, I'm assuming, are weakened by the illnesses. And of course, there are all those drugs that were taken to treat them. First, we heard of mucormycosis or black fungus affecting thousands, claiming many lives. Dr. Handa, your experience with treating black fungus, were you expecting these new variations? How is this green fungus different from the black fungus, if at all?
See, last 6 weeks or so, we have been really bombarded with these mucormycosis cases, also loosely called black fungus. I will give you an example. Before the COVID, I used to see 1 case a month. And in the first wave, 1 case a week. But in the second wave, started seeing about 15 to 20 cases per day of mucormycosis. Now, mucor was hitting our areas, ENT areas, nose, paranasal sinuses, eyeball, very hard. And in fact, some of the hospitals, we had a dedicated ward for mucor. Now the primary cases have started declining, but there are revision surgeries, there are patients being referred from elsewhere. And it hit us very hard. Now regarding green fungus or aspergillosis, it is not something new. In the first wave also, we got, say, if you were getting 70 cases of mucor, about 10 to 15 were aspergillus. But maybe the common sinus and lung involvement, those cases are rare. But aspergillus is again a known fungus like mucor. It is a ubiquitous common organism which is there. But whenever there is immunocompression, say the wave 2 happened, uncontrolled diabetes, patients on long uses of steroids, higher doses, then the immune system could not take it and they become affected with mucormycosis and some cases of aspergillosis, also called green fungus.
So, doctor, I just want to try and understand this as a lay person, right? Is this the same as when you hear of people who've got cancer undergoing chemo, people in the ICU, and then you say that, they didn't actually die for the disease for which they went to the ICU. They died of, other complications, basically when your immune system is compromised. Is this along the same lines?
Yes, this mucor or aspergillus used to happen in immunocompromised patients who had undergone transplants, were on immunosuppressive treatment and were rare. Now this has happened and the patients are not, they did not die so much of COVID as so much of mucormycosis. In fact, in our hospital, which is a tertiary care hospital, today we have more mucormycosis patients than primary COVID patients. And all of them are in a setting of uncontrolled diabetes, has had within 6 to 8 weeks of COVID infection and have taken steroids.
Dr. Rajwala Bhaduria, the emergence of these fungal infections among COVID-19 patients post-COVID, has that now placed an additional strain on our healthcare system? We were already brought to our knees by the second wave of the coronavirus. We saw hospitals across India struggling with the shortage of medicines, oxygen and hospital beds. Now it seems like, we're in this lull phase between a second and, God forbid, a third phase of the coronavirus, but you still have to deal with these complications of COVID patients post-recovery.
Yes, the black fungus epidemic started even before this wave of COVID had finished. Yeah. Right now we are a little better off, but when it came as a sudden surge of so many cases. It was a tremendous strain on the healthcare system because most of our people were employed already in looking after the COVID patients. Absolutely. And then this mucor came, and it was not a one person to do this job. It's a teamwork. So we had some people who had to do the endoscopy surgery. There was another team doing the work of the medicines. Then there were the nurses who had to get used to giving that amphotericin B. It is one of the drugs which was not generally used, and our nurses and people were not trained to give it. The drug itself was a big problem. So then we created wards, dedicated wards for mucor cases. So tremendous strain on the healthcare system in the beginning. Now people have understood it, and now we are a little bit better off as the cases have also declined and COVID has declined. So we are on a better footing now, and initially drugs were also not available.
Absolutely.
So
well, while all of us, the layperson, gets to take a bit of a breather between these two phases, unfortunately that's not the case for our health workers, our doctors, our nurses. They're still working on the clock, if not with COVID, then with post-COVID complications. Dr. Mahesh Lakhe, then what are the symptoms of this green fungus as opposed to the black fungus, if this is what we have to worry about or deal with now?
Thank you, Sarah, for having me on this show. First of all, I would like to, make a clarification that, do not call it as a green fungus or mucor as a black fungus, because, when you call black fungus, it is the other fungal element like Aphidia, Canakinumella, etc. So mucor mycosis, as we, Dr. Anda, it's more common in patients with badly controlled diabetic or patients who are on cancer chemotherapy or immunosuppressive agent. Similarly, aspergillosis. Aspergillosis is also quite commonly seen in patients who are receiving these immunosuppressive medications and cancer chemotherapy. or patients who are undergoing a bone marrow transplant, etc. So for these patients, most of the times, prophylactic antifungal agents like voriconazole or posaconazole, people from oncology and hemato-oncology they prescribe. But with COVID-associated infection, we need to remember a few important that COVID-associated mucormycosis or aspergillosis is most commonly seen in sign of infection, and apart from that, lungs is the second important area where this infection. So, mucor or aspergillus, the most important diagnostic test would be the histopathology. And apart from that, the culture to identify its the species. But histopathology is quite important because you need to show that there is an angio-invasion actually which is happening because of the fungal filament. Because since sinuses are the non-sterile areas, here a lot of these fungal filament be there in so many other. Just take out sample and grow it, you take to them. But ultimately, you have that it is invading into the blood vessels of these patients and ultimately leading to the full invasion as well. So the symptoms.
So post-COVID checks are important. Constantly monitor yourself. Constantly go see your doctor. Watch out for symptoms. Dr. Ravi Doshi, then now that you've experienced all of this, this almost sounds very depressing when you hear of all of everything you doctors are saying. So, can one prevent it? What do you do if you've had COVID and your immunity is low? I mean, what do you do apart from just staying home and making sure you don't catch anything? Can one prevent catching the green fungus, Dr. Doshi?
Well, ma'am, first of all, I would like to correct the statement by saying that instead of depressing, we should look at it in a more optimistic point of view. Why? Because now we are able to localize more. We are able to isolate these organisms very pinpoint and offer them very good and precise treatment. So I would say identification of any reason of a problem post-COVID is a hope in itself. Secondly, coming to the point that what to do, how to prevent. Well, the fact about all antifungal diseases is that if you have had COVID, or if you are on immunosuppression, or if you are a diabetic, a cancer patient on chemotherapy, post-transplant, you have to be on the lookout for early symptoms. What are these symptoms? They can be related to your nose, like nose block, bleeding nose. They can be related to your eyes. You can have loss of vision, protrusion of your eyeball, or eyes becoming very red. They can be related to your jaws. You can have severe jaw pain. You can have tingling, numbness, or loss of sensation over the face. Then you can have a lot of fever coming, which is not resolved by your usual stuff. The best way to take care of any fungal infection is show your symptoms early to a doctor, let him diagnose him. They might prescribe you a lot of higher radiological tests like CT and MRI, or often in biopsy. But my suggestion is, in this day and age, better to go to a doctor and get yourself evaluated thoroughly. You can diagnose early and get okay.
All right. I have to go in for a break, but I want to just ask you somebody has tweeted us on Twitter. Surinder Shetty says that the green fungus is caused by the Aspergillus fumigatus. It is not contagious. Probably the wards were not fumigated or kept clean, causing the growth of this fungus. Dr. Doshi.
Well, this is a hypothesis proposed for most fungi. Even for mucor, they told that it was water responsible. But we did a study in our own college, multicentric at Indore, where we find people staying at home also. They were also infected with fungus. So I do agree that more research is needed, more understanding is needed. But as far as best of these cleanliness practices are being observed at most hospitals whosoever are managing COVID. So I would say that it is a matter of research, and we need to learn more, understand more.
All right. I'm going to go in for a short break. I have more questions for Dr. Handa, Dr. Baduria and Dr. Lakhe, but remember, our cases have been falling. I think we're in the 60,000 range now, but doctors still facing a challenge, not just from the spate of fungal infections or fungal related infections. There's also TB to look at. We're going to go in for a short break. After that, today we saw 3 children infected with the black fungus undergoing a surgery to remove an eye each in Mumbai. We'll come back to this story and more. Stay tuned. Our doctors will be back after a short break. I think the audience is concerned about this simple question that everyone wants to know about is this contagious? Like, how can you get it?
Yeah. Not contagious. Because these are all soil organisms, these fungal filaments. That is why they can easily be inhaled by anyone on the roads, especially where construction activity comes. So that is why people have COVID. Even after that, if they are passing through areas where there is construction happening, we advise them to mask, which we use and throw kind of very important. Apart from that, drugs like steroids, etc. Now they are not, for patients with COVID in the first, in second. So that is why I think the immune suppression effect is only because of COVID now. So that is why it's very important even for kids to use masks. And apart from that, repeating the same mask again, I would advise. Because if you correct mask again and take care of yourself, then should not be anything to panic.
Okay. Dr. Doshi, when we were reporting at the height of this black fungus cases being reported, there was also this a scary shortage of drugs to treat the black fungus. Are the drugs to treat the green fungus different, and do we have that in enough supply?
Well, very glad to say that there are enough stocks of drugs required for green fungus available. The azole group, particularly voriconazole in particular, is not only available in a single brand, but is available in a lot of makes. So there is no shortage as such of green fungus treatment. Very freely available.
All right, and quickly, can I ask you? We've heard so much about the cytokine storms, etc., because where the immune system goes into overdrive, damaging organs. Is all of this related, this may have been asked before, to the overprescription of steroids to reduce the immune response? Is this a catch-22 situation where you have to prescribe steroids to reduce the immune response, but that then weakens the body's defenses, increases sugar levels, etc., which funguses thrive out of, which is why a lot of these patients are diabetic?
Well, cytokine storm is a very common and dreaded complication of COVID-19. So we have to understand that steroids are the treatment of choice. If used in measured doses, they help a lot. We are continuously studying our old prescriptions retrospectively, and we have come to understand that steroids are one of the reasons of this particular fungal problem. They are not the only reason. So if prescribed, they can save your life. And if you have a life, then only you will be fighting the fungus. Ultimately, I would say use of steroids is absolutely mandatory, and we definitely, the practice has changed to being more careful, particularly in risky scenario these cases.
So the use of steroids absolutely important, but listen to your doctor and do as they prescribe. Thank you all for joining us tonight on FYI. We appreciate your time and thank you for your service. That's it on FYI. We'll be back tomorrow with a different episode of information that you can use. Bye-bye.